Hey guys, Dr. St. Jean here at thechicagochiropractor.com. Today we're going to talk about a really important subject, and that is when your low back pain is considered a medical emergency. Let's get started. So which signs and symptoms should we be aware of to tell whether or not the back pain we're experiencing is considered a medical emergency? First off, you got to have low back pain, right? That's one thing. And then you're going to see a combination of several different signs and symptoms in conjunction with low back pain. One that comes to mind is saddle-like numbness and tingling. What do I mean by that? I mean numbness and tingling in a saddle-like distribution along your lower back and buttock. So the specific areas where you'd be experiencing this would be your inner thighs, your butt, around your anus, a little bit around your lower back. Think about all the areas of your body that would touch a saddle if you were actually riding on a horse. If those are numbness and tingling, if they're experiencing numbness and tingling, that's a problem. Other symptoms and signs you want to look out for are weakness in the legs or the lower extremity in general, and then of course bowel, bladder, and sexual dysfunction. Obviously, if some of these things are happening, you're going to have an idea something is wrong. But when you have low back pain with any of these other symptoms and signs, you need to go to the emergency room right away. So what makes things a little tricky is that these symptoms don't always appear all at once. Sometimes they happen a little bit slowly, and one appears and then another one, and you don't know what to make of it. So what should you do? Again, a lot of people will think, hey, I'm just going to call my chiropractor. That is definitely a no-no. Some might think call their PT. No. Maybe call your primary or make an appointment with your primary care. No. If you're experiencing those symptoms, I'm going to reiterate this one more time. If you're experiencing any of the symptoms I just listed plus low back pain, you're going to go to the ER, the emergency room. Super important. So what we refer to all this is cauda equina syndrome. It's again a medical emergency. It's extremely rare. Maybe as a physician, you'll see it 1 to 3 times in your entire practice career. Basically what it is where the spinal cord comes to an end is called the conus medullaris. It's usually around the L2 vertebrae, so the second lumbar vertebrae in your lower back. It kind of comes to a stop like that, right? And then at the end you have these nerve roots flowing off of it, and the nerve roots kind of look like a horse's tail. They kind of look like this. And those nerve roots supply your lower extremity and your pelvic viscera, your pelvic organs. So really, really important nerve roots. They send and receive messages from those areas. And when they're compressed, this is what causes cauda equina syndrome. The name comes because these nerve roots look like a horse's tail. Cauda equina means horse's tail. So again, it's the compression of these nerves that actually causes the syndrome and causes all the symptoms that we just went over. Again, you really want to take something like this seriously. If you don't do anything about it and you just put it aside, it can result in some serious damage. We're talking permanent paralysis of the lower half, loss of sexual function, a loss of your control over your bowels and bladder. So really severe things that you really just don't want to mess with. If you're experiencing these symptoms, again, you know what I'm going to say, go to the ER. Okay guys, we just went over all the signs and symptoms associated with low back pain when it's considered a medical emergency. Sear that into your mind like you seared 911 on your telephone when you were a kid into your mind. Obviously, it's not something to mess with. It's actually caused most commonly by a massive, massive disc herniation, if you were wondering. If you want more information about low back pain, click the link below to go to our blog. We have a ton of videos, tons of articles on the topic. If you want to work with myself and get to the root cause of treating your low back pain, then click the schedule a consult button now. I'll look forward to meeting you soon. This is Dr. St. Jean at thechicagochiropractor.com. See you next time. Bye-bye.